Well, it is WesTex Wednesday, and Dr. Beck is here with us to talk about the latest in our health news. Dr. Beck, thank you so much for being here today.
Well, thank you for having me.
So today, liver disease.
Yes.
There's, I think, alcohol right away, because I know that's what our liver kind of helps do. But how important is our liver, and what are some causes for liver disease?
Our liver is extremely important. It is unlike the kidneys or the lungs that are paired organs. We only have one liver. The main purpose of the liver in our body is to detoxify anything that we put in our body. And you talked about alcohol. Probably the most common cause of liver disease is alcohol. You know, someone who drinks excess alcohol. And it can lead to inflammation of the liver, where it becomes not infected but inflamed. We call that hepatitis.
Oh, wow.
And hepatitis just means inflammation or irritation of the liver. And there's a number of things that can cause hepatitis. And if I get back to the alcohol portion of that, alcohol over a period of time, it usually takes a long time, but you have some people who may be more susceptible to it than others as far as cirrhosis. Cirrhosis of the liver is where the liver is scarred down and it cannot function properly, and it can cause all kinds of health problems related to that. Wow. You know, someone gets kidney failure, you can always put them on dialysis. There is no artificial liver that we have out there because it's such a unique organ in the body, and it's very forgiving to a point. Once you cross that line, then there's kind of no going back.
That kind of leads me to my question. Are there any treatments for inflamed liver, or maybe some issues with the liver when it comes to alcohol or other dangerous activities?
Yeah, there are treatments, but the majority of the treatments are removing the whatever agent it is that has irritated the liver in the first place.
Okay.
For instance, someone that has liver disease should really avoid alcohol. High doses of Tylenol can be irritating, and there's lots of other medications out there, and it may just be a matter of being able to look that information up or speak with your healthcare practitioner to see what medications may need to be avoided. The other thing that's a big cause of liver disease or hepatitis is viral infections. We have different strains of hepatitis. The most common ones are A, B, and C. A is mostly foodborne. In other words, you can get it from eating food that's been contaminated, eating or drinking after someone that has hepatitis A. Hepatitis B and C are more serious. Hepatitis A, you'll get over that. You'll be sick for a week or 10 days. You can get jaundice, fever, nausea, vomiting, but you're going to get over that, and there's no chronic form of hepatitis A. On the other hand, hepatitis B and C are much more dangerous. Hepatitis B and C are mostly contracted either via sexual contact or bloodborne products. In other words, a needle stick or IV drug users are at high risk for hepatitis B and C. There is a vaccination for hepatitis B. And I strongly encourage and recommend that for everyone, especially healthcare workers. There's no vaccination for hepatitis C, but there is some new treatment that's come out in the last 5 or 10 years that can pretty much eradicate the most strains of hepatitis C from the body.
Wow.
Yeah.
So, too, I want to talk about symptoms as well. Like, when do people know that there's something wrong with their liver or could possibly have a disease?
Right. And early on, it may be hard to know because you may just feel nauseated or have some abdominal pain, maybe some low-grade fever, but definitely when someone develops yellowing of the skin, or what we call jaundice, that's definitely an indication that there's something going on with the liver. There's other things that can cause jaundice too, like if someone gets a gallstone in their gallbladder and it blocks certain ducts in or around the liver, then it can cause people to get jaundice or turn yellow. But again, somebody who has yellow skin, that's not normal, yellow skin or yellow eyes. So it could be those symptoms, and then the symptoms can progress from there. But those are some of the early warning symptoms that there's something going on with the liver.
Very, very helpful information. Thank you so much for that, Dr. Beck. We do have Dr. Beck's contact information on our screen for you this morning. If you're interested in checking out his facility or maybe even the treatments that there are for liver disease, thank you so much again for all that helpful information.
Thank you.
But after a break, we will have one last 7 look at your 7-day forecast and a recap of your top stories from this morning.